So today's topic is HIV services. Those who have the textbook, please mention the page number in the chat box from your quality control management textbook. So infrastructure of HIV. When you have an family planning services, usually it's not called HIV department in the hospital. There are other names used to it because there is a certain stigma attached with the word HIV. Okay, so any person, any visitors who come into or go into the room in which HIV services is written, okay, it will create some public outcry or stigma, okay, regarding this. So that's why other names are used. HIV or AIDS names are not used in these areas. Okay, so there are certain functional places that should be available wherever the hospital has an infrastructure for HIV services. Okay, there is one waiting area. Okay, and in which most of the HIV patients, they also suffer from TB. Okay, so it has to be a well ventilated waiting area. Okay, HIV patients are very susceptible to TB. Most of the HIV patients or AIDS patients by the last stage, they have TB. Okay, so whenever they come to these infrastructures, the main thing should be the ventilation of the waiting area. Okay, adequate waiting space for an additional 25 visits per HIV, per 250 people living with HIV. PLHIV means people living with HIV. So if your hospital has around 250 registered cases of PLHIV, people living with HIV, so a waiting space for at least 250 visits, 250 people sitting, but in a very well ventilated area. Okay, so that much attention should be given. Into areas for stretchers, wheelchairs should be provided to park stretchers and wheelchairs. Additional waiting space could be required to give counseling. Okay, phlebotomy, laboratory phlebotomy, where blood withdrawal is done. Okay, blood sample is collected. Pharmacy venues. Okay, these should the if these are not near the OPD, additional waiting space for these also should be given. Okay, so 25 plus at least 10. Okay, for people who have come to give blood samples or people who are waiting for OPD. Registration or triage area, one triage area. In triage area, you have to make sure that you look out for signs and symptoms like frequent coughing, blood and sputum, patients who are look extremely thin, muscles which are wasted. Okay, so you have to segregate them away from the general crowd. Okay, so one registration or triage area is given. Consultation rooms, at least three consultation room or examination room. Okay, one for every 250 to 500 positive patients. If you have at least 250 to 500 HIV patients registered in your hospital's registry, okay, at least three should be given. Three plus one, so four. Okay, so four consultation room. So one room for every 100 cases like that. Okay, and these are the dimensions. Okay, or dimensions you don't have to remember, only if you are practically going to build an area for HIV services, these dimensions can be used. Okay, so these consultation rooms or examination rooms are used for different purposes. Okay, it could be for antenatal care. ANC is antenatal care, pregnant mothers, HIV positive mothers. Okay, for family planning, OPD, EPI, okay, mother and child health, under 5. Then TB and dot center, where dot therapy is also given. ART medications are also given. Okay, counseling and testing is also done here. So these are the purposes used for this consultation and examination room. Okay. Then you can have a labor and postpartum room, one labor and postpartum room. The items required in the labor room, you can go to the previous class and see. We have discussed that. Okay. Dimensions are given. Small healthcare centers will not have labor room, but if it is a hospital, there will be a labor room, postpartum room attached to the HIV infrastructure where HIV positive mother can deliver. Okay. One delivery room is also given, and a bathroom should also be given there. Counseling room, HIV counseling and testing rooms are given, which where psychosocial support is given to HIV positive patients. At least 3 + 1, 4 counseling room with psychosocial support should be provided. So counseling services, you can use visual and auditory privacy. Okay. In HIV counseling room, it should be in the infrastructure should be done in such a way that people sitting outside should not hear what's going on inside. Okay, what discussion is happening inside, and the visual there should be a visual privacy as well, in which uh, you can't see who is sitting inside. Okay, and less formal spaces can be used, which feels like a safe space for people to communicate. Okay. If it is very formal, like table, desk, okay, all these things, people, the counselors or the counselee will not be that open with the communication. Okay. Testing and the counseling can be conducted in number of different private spaces, including the allocated rooms and other spaces as well. Okay. In many hospitals, under the name of family planning, HIV services are also given. Then group counseling space. Here, all the people who are living together, living with HIV, okay, they can communicate with each other. Okay, other patients who are undergoing the same situation. When all the patients who are diagnosed and undergoing the same situation, they can get group counseling. Okay, so this is a large room with an out, or you can do an outdoor space also for 20 to 50 people, at least to accommodate 20 to 50 people. Okay, maybe outside the waiting area where support group meetings can be done, peer education can be done. Okay, so if you want to give the same health education to everyone over and over again, it's better to do a group session. Okay, laboratory analysis for specimen can also be taken. One laboratory, at least 1 meter of working surface should be there for one individual. So based on how many technicians you are hiring here in the laboratory. Okay, if there are 3 technicians, 3 meter of working surface of platform should be there. Okay, rapid testing equipments also should be available here. Rapid testing is done to rule out TB and all. Okay. Phlebotomy side, where blood sample is taken, where arteries and veins are punctured using a needle to withdraw blood. One phlebotomy room. It can be associated along with the laboratory. No need for a separate room. Okay, adjacent to the laboratory, phlebotomy space can be given. Specimen labeling and preparation site, one area. Okay, usually it is inside the laboratory. TB sputum collection should be done in open air. There is no room for it. Okay. Always TB sputum collection should be done in open air. Pharmacy dispensary, one, where solutions are prepared. Pharmacy stores where medications are stored. It should be large enough to fit all supplies, and all supplies should be kept properly labeled. Okay, properly ventilated. clean, dust free. Or if it is a small healthcare center where you can't give an entire room for pharmacy store, a big cupboard with cabinets which can be locked can be provided. Okay. Two staff toilets, male and female, separate. Two patient toilet, male and female separate. Okay. One can be used for urine collection as well, urine sample collection. So privacy and confidentiality should be there with respect to the infrastructure. As I mentioned earlier, auditory blockage and visual blockage should be there so that people sitting outside should not hear what's being discussed inside. Okay. Signage system, proper signage system should be there, which does not show that this is an HIV service. It should more look like a family planning center and all. Appointment systems that shield the patient's name. Okay. Patient's full name and all should not be visualized from outside. That should be the appointment system. Medical records that minimize accidental disclosure, because you have to protect the identity of the person living with HIV. List of people living with HIV registered, that has a list, contact number, addresses, okay, family, relatives, a kin's name, and their contact number and address, everything has to be mentioned. Then triage infrastructure, look for the comfort, safety, and privacy. The ventilation, comfort, security, these things, these issues has to be looked after always. Okay, never to disclose, no instance should be there where an accidental disclosure of patient's name takes place. Okay, desk, two chairs, cabinets, okay, which can be locked as well. Other equipments like thermometer, weighing scales, BP machine, sphygmomanometer, stethoscope. Okay, these items also should be sealed properly. Patient cards, which has patient's details and everything, those should be kept in a locked storage. Then filling cabinets that can be locked, or shelving systems that can be used for storage and organize patients' files. In clinical consultation room, where a doctor will be there for examination and all. So it should be, privacy should be upholded. It should be well ventilated. Sink should be there for hand washing and all. At least 3 chairs should be there. Examination table with privacy screen, hand washing area, additional light source if needed. Color coded waste containers. Access to hand washing should be there with all the hand washing equipments. For doctors' use, certain graphs, books, posters, textbooks, stethoscope, thermometer, sphygmomanometer, stadiometer, hand washing supplies. Different scales for adult and infant should be also available. Patient education materials, pamphlets, which you can deliver to the patient as well. Okay. A condom dispenser as well. Then counseling infrastructure. This is the counseling room. Okay. So post-test prevention messages should be there in poster theme on the walls. Reproductive choice and family planning counseling should be given. Partner and couple counseling segments should be a time scheduling should be done. Discord and couple counseling. Okay. Safer sex and risk reduction counseling. Disclosure support. If you are disclosing that a person who has HIV, they're disclosing it to their family member, how to disclose it. Okay, the support. STD counseling, adult male circumcision counseling, PMT, CT counseling. This is for mothers, pregnant mothers and all. Infant feeding, nutritional counseling. If a pregnant mother is giving birth, okay, how to, what about breastfeeding? What about the nutrition of the newborn child? Okay, this counseling, psychosocial support. Children who are born to HIV parents or children who are born infected with HIV, okay, their caretakers, how to take care of them. Post-rape counseling, okay, these should be the topics of counseling in the counseling infrastructure. So the counseling area, which should be well covered, well ventilated, privacy should be there, space for at least 3 people to sit comfortable and talk, counselor, and then the couple. It should be well privacy protected. Discrete signs, visual and audio privacy, like soundproof walls and all should be used. Blackboards, storage cabinets, bookcases, waste containers, access to hand washing. Posters again, audiovisual aids for health education, posters, brochures, pamphlets, handouts can be placed that they can that they can give it to the patients while they leave after the counseling. Counseling support tools like flip charts, prevention wall charts, diagrams. In pamphlet form also this can be made and given. Male and female condom dispenser. Penis model in which you can teach the patients how condoms should be worn. Okay. And even female reproductive models in which you can show how a female condom can be placed as well. DVD player in which certain advertisements, short movies, short videos regarding HIV counseling can be shown to the couple. Waiting area, it should be well ventilated as I mentioned earlier. Covered outdoor waiting area is much better, in which it will be well ventilated. At least one entire wall should be open, so that is a well ventilated room. Coughing patients should be separated, they should be triaged. Toilet facilities, hand washing facilities should be there. Play area for the children also. Educational posters can be kept. While waiting, the patients can just go through the wall posters, learn something. Condom dispensers are available. Then the pharmacy and dispensary infrastructure, there should be restrictions of the amount of keys that you can make. Okay, so that access to everyone should not be possible, especially if narcotics and heavy expensive items are kept in the dispensary. Okay, Too many keys should not be distributed. A private space along with the pharmacy can be made for patients' counseling. Control of temperature, light, humidity, water, pest should be there. Otherwise, it will spoil your medications, stored items. Proper shelves, organized supplies and organized shelves should be there. Waste containers, color-coded ones, hand washing area. Different container for hazardous waste, like expired drugs, cytotoxic drugs. Condom dispenser. So these are the areas for an HIV infrastructure. This topic can be used as a checklist as well.